Good evening, ladies. My name is Jeraine Simmons, and welcome to Ageless Ambition. Tonight, we're talking about a serious topic that is gaining popularity and attention in the healthcare community: GLP 1 meds. Tonight, we're focusing on GLP 1 meds, and my goal is to make sure that you're hearing not just opinions, but professional perspective of GLP 1 meds, and make sure that you do have a voice and you do not have to be silenced by other people's judgments, and that this is a safe space for you to, receive feedback and then make your decision soundly and move from there. Tonight I have with me Brandy Atterbury. She is a biochemical engineer and a student pharmacist. Welcome, Brandy.
Hello, hello. Thank you for having me.
Welcome. Brandy, can you tell us a little bit about what is a biochemical engineer? And as a student pharmacist, can you describe a little bit about that? I'm not even sure fully what that entails.
Well, biochemical engineer can touch a broad range of spectrums from working in like the oil industry to working in the pharma industry. So I have spent the last 20 years in the pharmaceutical industry, where I actually made medications. And in making medications, I created the process for which the drugs or medications would be manufactured on. So most of the time, it takes about 10 to 15 years before a drug goes from discovery to market. So, in
Mm-hmm.
that 10 to 15-year process, it goes from discovery and then it comes to me in my lab, and I make it safe to put inside humans and create the final process for which the drug will be manufactured under. How I segued into becoming a student pharmacist is a couple of my drugs did not get approved after
Mm-hmm.
spending about 6 years working on them. And
Mm-hmm.
we had excellent clinical trials. All the kids actually lived when they weren't supposed to pass the age of 2. And they were all 9 and 10 years old. And the FDA didn't approve those drugs. So I wanted to find out why. Why?
Mm-hmm.
And in doing that research, I found out that there is a lack of pharmacists, or
Mm-hmm.
farm doctors of pharmacy in the pharmaceutical space that actually make the drugs. There's a lot
Okay.
in regulatory, there are a lot in pharmacovigilance and all of the paperwork piece, but there's no one in the lab to kind of dictate how these medications and the things that we're putting into these medications will cross like the blood-brain barrier, or how they will work on the body. So you basically have a scientist like myself who knows the science, but I don't know how it affects, anything down the line, or what
Mm-hmm.
types of things it would be working on outside of what it did in the mice or clinical trials. And so I wanted to get a broader perspective on how that all work together. So that brought me here after 20 years doing a complete pivot. And here I am as a student pharmacist, but I was a biochemical engineer. I'm still a biochemical engineer for the last 20 years.
Excellent. Excellent, Brandy. And, hats off to you for, walking in that role as an African American woman and all the research that you're going to discover along your journey. So let's get into it. So, the definition of GLP 1 medications are a class drug that mimics a natural hormone in the body that helps regulate blood sugar, slow down digestion, and also reduces appetite. So, Brandy, from your perspective as a student, basically a student pharmacist, what should women understand about GLP 1 meds? Now, of course, I know that you have a personal side and a professional side. Can you share a little of both, please?
I think from a professional side, some of the common misconceptions of GLP-1s is that it's just like a natural appetite suppressant. That's the
Mm-hmm.
main thing. So everyone's like, "Well, I can just take an appetite suppressant,
Mm-hmm.
as opposed to getting a prescription or using my insurance to take an appetite suppressant." So that's one of the biggest misconception, and it's not. actually working on metabolic pathways in the body that suppress not only your appetite but gastric emptying. It's also going to um, dictate some of your insulin secretions.
Mhm.
If you are pre-diabetic
Mhm.
or have diabetes or whatnot, it's gonna help with the storing of glucagon, which also uh, increases weight gain. Because
Okay.
sometimes we have a high storage of glucagon
Mhm.
along with glucose that causes us to hold on to weight as opposed
Okay.
to losing weight. So it's also going to help increase metabolism because you're getting rid of some of that glucagon because glucagon doesn't metabolize like glucose. It has to be converted to glucose in order for it to be metabolized. So that's a little bit of the science.
Okay.
um,
Okay.
I think some of the other things around it are you can't like stop it and then start it again. When
Mhm.
obviously because it does decrease gastric emptying and things like that, and it does have some other side effects like cancer, things like that when you take it for long periods of time. So it's not recommended to take for a long period of time, and it is
Mhm.
actually recommended that you start and that you can stop it and continue a regular, healthy weight loss journey. So it's not something that you have to take for a lifetime. You're not even
Mm.
supposed to take it for a lifetime. You're
Mm.
supposed to take it until you get to, a healthier place. And
Mhm.
then, just like you, I think with most of them, at least, and from a personal perspective, I've been on them. So they kind of increase your dose over time until you
Yep.
get to the highest dose. So it would be the same way with you could either decrease your dose to come
Mhm.
off, so that way you're adjusting your appetite, the appetite suppressant piece. So the lower the dose, it's not going to suppress your appetite as much. And you're also increasing your gastric emptying as you're coming down. So you can also make that request depending on which GLP-1 you're on. Say, hey, I'm thinking of coming off. Can I wean myself off so that I don't
Mhm.
just go back to eating unhealthy and taking in all the
Right.
food? But you are allowed to stop, and it is recommended to stop. It's not I got to take this for the next 20 years of my life in order to maintain a healthy weight. So I think that's one of the misconceptions around it as well.
Right. Now, excellent. Now, you said two things in there that I just want you to expound on: the word glucose and insulin,
Hmm.
because we know that that's related to diabetics, but
Hmm.
also just regular people when they eat, their pancreas secretes insulin so that their blood sugar can go down and it not
Hmm.
elevate. But it does
Hmm.
elevate, but with normal people, the glucose goes back down. So can you
Hmm.
talk a little bit about that area and then also the weaning part? Because I'm gonna be honest with you, is that I thought that you had to be on it forever. Like once you started, you had to be on it for the rest of your life, or you would gain the weight back and your appetite would come back, like, like you know, 3 times, and more people end up gaining more weight back. Can you talk a little bit about both of those areas?
Okay, so the insulin and glucose piece. Insulin obviously produced in the pancreas, and that lowers our glucose levels. So naturally, when you eat, it becomes a carbohydrate. Carbohydrates break down into glucose
Mm-hmm.
and whatever other amino acids, proteins, and things like that. What we don't need is excreted in our bowels and in our urine. What we actually
Mm-hmm.
need is put off into the bloodstream,
Mm-hmm.
and the glucose is used to create cellular energy.
Mm-hmm.
If your pancreas isn't producing enough insulin, either from
Right.
weight gain or because you're a natural diabetic like myself,
Mm-hmm.
your insulin isn't um, eating up the excess glucose that isn't being converted to energy. So when you have excess glucose, now it's going to go into the liver now converts excess glucose to your fat storage, which is glucagon.
Mhm.
and glycogen. And
Mhm.
those things are stored for when you need them as an energy reserve, and they're used, but they don't burn off as fast as just pure sugar or pure glucose or pure carbohydrate.
Right.
So
Right.
because a lot of people end up having when you gain weight, your body obviously at some point either you weren't eating enough, you weren't eating right or healthy enough, so your body decided it was going to store all of
Yes.
this excess glucose for,
Mhm.
hey, I'm gonna use this for energy later, and because you haven't been expending any energy, it's just saving it up for when you want to use it. So
Wow.
that's how the GLP-1 kind of helps. It
Mhm.
helps reduce some of that glucagon and glycogen storage in the liver, or that's being stored up in your fat cells, to be released and be used, and as well as the insulin piece. So it's signaling that, we got insulin that can be used, because I know in some cases when you're type 2 diabetic, you produce insulin, but you're not producing
Mhm.
either enough,
Mhm.
or you're overproducing and it's not
Mhm.
functioning correctly. So it kind of puts a stop to that process, or
Okay.
aids in that process.
Okay, so you're telling us that when just women gain weight, their insulin secretion goes down? Is that what I'm hearing?
It can. It can.
It
It's
can.
not
Okay.
always the case.
Okay.
It is the case when you have a predisposition for type 2 diabetes.
Okay.
And not everyone does, but that's
Yes.
how diabetes functions in general, type 2 diabetes. You produce insulin, but either you're not producing enough because
Mhm.
you haven't been burning off enough of your glycogen or glucose storages. So your
Mhm.
body's like, hey, we don't need to produce as much insulin because we're not getting rid of it. So we're going
Oh,
to slow
okay.
down.
Okay.
And that's
Okay.
where the weight loss piece comes in. Well, if you lose weight, you start using some of that energy. And
Mhm.
so that's how you get rid of type 2 diabetes. I'm going to work out, lose weight, get
Right.
use some of this energy, and then your body's going to go back to functioning normal.
Right. Because I remember when my doctor, he sat down with me and we did my blood work and I was pre-diabetic, cholesterol levels was up, blood pressure levels was up. And he sat down with me, he said, "Let me help you, with this." And so he put me on a GLP-1 med, and then 6 months later we redid my blood work. The I was no longer pre-diabetic, and I was like just that borderline. My cholesterol levels went down. They were just like a couple numbers over, and so they went down. And so what I will say is that I did practice healthier eating habits. I took some of my main sugars out of my you know took my diet and focused more on just eating more healthier. So my three main things were dessert, wine, and rice. So I took them out for that period, and then I did notice that everything went down. So when you talk about basically the insulin, the glucose, the weight gain, and if you're not eating, what I'm hearing is that if you're not eating, because a lot of people feel like, okay, let's skip meals, right? That helps. Can you talk a
It
little bit
doesn't.
about, like, from that perspective to help women understand that they should not skip meals?
Okay. From a just a scientific perspective in general,
Mhm.
your body needs energy to function.
Mhm.
If
Mhm.
you're skipping meals, you're not functioning to your highest potential.
Right.
Yes, there should be a period of fasting, so
Mhm.
that your body can kind of process all of the foods, which is why we don't eat while we're sleeping. And in the
Right.
morning, you break the fast with breakfast. That's why it's
Breakfast.
breakfast is break fast.
Mhm.
So in breaking the fast, you are now giving your body fuel to function the next day, because you have to have carbohydrates in order to create ATP to get cellular energy. If you're skipping meals, again, you're telling your body, hey, I'm starving right now. I'm not going to
Mhm.
eat. So it's going to hold on to all of your energy. It's going to hold on to all of your energy reserves, which is what causes weight gain. You're not taking in any energy, and then
Right.
at the same time, you're not burning any energy. And then people think
Mhm.
that, oh, I gotta work out. But if you're not giving your body any fuel to do those workouts,
Yes.
you're still not
Yes.
going to lose weight, or you'll lose water weight and you'll
Mhm.
lose muscle. And that's why some people can work out really hard and be look and feel like they're in the best shape of their life, but then get
Mhm.
a
Mhm.
horrible report from the doctor because they have no muscle mass.
Right.
So it's twofold. You have to eat to live,
Right.
um, or you're not going to live if you don't eat. And you can mess up your metabolic flow if you're not eating, or just eating once a day,
Mhm.
or um, starving yourself for 20 hours out of the day, and I'm only going to
Mhm.
eat everything within 4 hours. That's not healthy. And especially
Right.
if you're putting on, adding in, I'm going to work out 2.5 hours or 3 hours, or whatever have you, to kind of keep the weight off. It's not healthy. So you have to have a healthy balance of eating and working out, and even weightlifting, in order to maintain a healthy lifestyle.
Right, right. I hear a lot of people talk about, my sister and my girlfriends, they always say, Jeraine, make sure you have protein in your diet. Make sure you have protein in your diet because that's going to help with muscle mass, but then also it's going to help with just your overall fullness, that you're going to feel
Mm-hmm.
more full
Mm-hmm.
throughout the day. So I did incorporate, my apples with peanut butter and things like that. Just simple things. And then I do feel better. My blood sugar feels better. And of course, making sure that I drink a lot of water with that. But with the GLP meds, because they're designed to, basically suppress the appetite, what is, in your perspective, this is not really clinical. What, in your perspective, that whole suppression of appetite, how much is too much to be suppressed? And I'll give you a little background on that. My doctor had increased my dosage. I literally did not eat for 2 days. I was dizzy. I had a vomit episode, and one of the clinicians said it's too strong. It's too strong. It's too much on your body. Like, you should not be going through these side effects. You should still be able to eat. You should not feel dizzy. You should not, be vomiting soon as you took the medicine. Like, maybe it's too strong for your body. And he lowered the dose and I felt better like after. So, as far as the appetite is concerned, how much suppression is too much?
I think, if you're not eating, that's a
Mhm.
problem.
Mhm.
And I under from a personal perspective, I haven't experienced any crazy like side effects,
Mhm.
on my actual GLP-1,
Mhm.
but I do have moments where I feel like, hey, I'm not hungry. But that's where I also do things like I just drink a protein shake. I
Okay.
won't not eat anything. Um,
Mhm.
I'll make sure I have some type of supplement. And I think that's probably just the biology scientist in me that says, hey, you haven't eaten. You need to eat something. So because
Right.
you're not hungry, let's drink a protein shake, or let's make a smoothie and sip on that, for the next hour or whatever, and put some protein in it so that you're getting some type of nutrient. So I'll, blend up some kale with some protein powder and some
Mhm.
strawberries and oranges and things like that, if I'm not,
Right.
because I try to, at least if I don't have a big appetite, I do try to meet my protein goal every single day,
Mhm.
even if that means I have to drink two protein shakes to at least get 60 to 90 grams of protein in my body every single day.
Right.
Because again, protein is the energy source. It's natural in our body. Our body creates protein. We use protein to make all of our amino acids. Our muscles are made of protein. So that's where increase your protein, and lower your carbohydrate intake, to have a healthy balance of food. And so that's my personal perspective on it.
Mhm.
So I don't think you
Mhm.
should not eat, even
Mhm.
if you're not hungry. Try to drink a protein shake. That's always my suggestion. Um,
Mhm.
you have to definitely do the research and ask the questions to your doctor and the staff that are treating you if you're on a GLP-1. Because
Mhm.
like you said, you thought it was something you have to be on for life. You don't have to. I wouldn't recommend that you be on it for life. There
Right.
are a whole host of side effects that come with the different types of GLP-1s that are on the market. You don't want to make yourself more susceptible to cancer or any of those things. Ovarian
Mhm.
cancer is one of the natural side effects. There's also age limits
Mhm.
that come with. I'm not going to say limits, but there's certain ages. If you have a history or hereditary cancers in your family, all of these things need to be evaluated. So
Mhm.
I think that if anyone is going to take a GLP-1, they need to ask the right questions and have make sure they're with a doctor
Mhm.
who is attentive
Right.
to those types of questions, who's gonna not just because you do have doctors that just prescribe you a medication because you asked to be on the GLP-1 to lose weight, but they didn't give you any of the background story or history. They're like, oh well, I'll put you on Zepbound or Monjaro, or you can try Ozempic,
Right.
and they never ask any questions from there.
Right.
But you have to be very knowledgeable about the medication that you're taking, so that you can lower the risk of side effects. And again, you don't want to just not eat, because unhealthy weight loss is not healthy. And then you'll find yourself weak and, looking sickly, as I like to term it. I don't know what else to term it.
Yes.
But you want to lose weight healthy and look healthy after you've lost the weight. I don't. I know that some can also. People tend to think that it's going to make you lose weight really, really fast, like you got a gastric bypass. And I think that's a
Mhm. Mhm.
misconception too, because again,
Thank you for that.
mhm, that goes into the that's why there's doses, so
Mhm.
we can, take you up, take you down, so that you're not losing 40 pounds in 2 weeks. And now you got to
Right.
have skin surgery and things like that. So I think that's another misconception that we find with GLP-1s.
I'm glad that you said that because I was under the impression that okay, it's a rapid weight loss because that's what I see is a rapid weight loss in some women. I know me personally, I said that I wanted the lowest dosage and wanted to build from there. I did not want to lose the weight so fast. And I remember, having that conversation with my provider. You talked a little bit about the conversation that we need to have with our doctor. Can you maybe give three important tips or questions that a person should ask, like take in their arsenal when they go to sit down and talk to their doctor about this medication?
So, yes, the first question I think, or the first topic that should be honed in
Mm-hmm.
on, are the studies that have been done on some of
Mm-hmm.
these drugs. Ask your doctor about any studies. Some of the GLP-1s, and I'm not even gonna say some. I'm gonna say most of them. Um, a lot of the side effects aren't conclusive in humans, even like the cancer portion, because they've only been studied in mice. So you need to ask those type of questions. What
Mm-hmm.
A lot of GLP-1s are understudied, and because some of them are even biosimilars. Like I know Ozempic started out as just a medication for diabetes, but they found that it suppressed the appetite. So then it became a GLP-1. I think Victoza,
Mm-hmm.
Ozempic, semaglutide, they were some of the first ones that came onto the market. So I would ask about studies, actual
Mm-hmm.
results, and or even do the research myself would be the first thing
Mm-hmm.
that I would do before going in to find out which GLP-1, and what type of side effects I'm willing to live with. If one, like, for instance, it slows down gastric emptying, but that doesn't mean that one could cause more constipation than another.
Right.
So if you're okay with having, 1 or 2 days of severe constipation
Mhm.
or stomach
Mhm.
cramps that come with severe constipation, then okay, you're okay with that. But there are some that have
Mhm.
milder cases, or there are even some that actually increase, bowel movements, maybe not as regular as you would if
Mhm.
you weren't on a GLP-1, but you can
Mhm.
have regular flows of bowel movements. So that would be the first question I would ask. What is
Mhm.
the how severe are these cramps going to be?
Right.
How often do I need to take the
Mhm.
medication? I think a lot
Mhm.
of them are once a week type deals now. I'm not sure if
Yes.
there's any that have progressed past once a week.
Mhm.
But the again, the side effects that are going to come, like you said, you were vomiting and things like that. So as you're increasing dosage, I think that it's important for women to I made a little journal from when I started my
Mhm.
GLP-1, like how I was feeling, what was my mood, if I worked out, if I didn't work out, if I threw up, if all the
Right.
things that I could still do. So then when I went and sat down with my doctor and said, okay, well, this is the dose that I was on, and this is how I felt over the course of these 7 days. Or I think
Mhm.
when I was moving up in my dosage, I would do mine for at least a month before, or a month and a half before I decided to go up. And then I would go up and then I would document how I was feeling. So then if I was feeling okay, if we went through my, month and a half journal or whatnot and saw, where I was feeling bad, she said, well, maybe you should stay on it at this dose
Mhm.
and then
Mhm.
see if, this improves. You can't always assume that a side effect is going to stay with you. So you have to give
Right.
medication a time to work as well. And I think sometimes as women, especially in the societies that we live in now, I got to be small, I got to be cute, I got to be beautiful.
Yep.
So they rush into, well, let's just hurry up and move me up so I can be at the highest doses so I can lose the most weight as
Yep.
possible.
Yep.
So I think that's something that people should do more research behind. Stay on it. Let your body use it at that dosage, because it could very well just work at, I guess 7.5. If we're on a 7.5 would be your
Right.
dosage. So let's just stay at 7.5 for as long as possible to make sure
Mhm.
it's doing what it's doing. And just because you lost 5 pounds don't mean go up to, 10 or 12 or however your dose is in
Right.
your particular GLP-1. I don't think a lot of women actually do their research behind that and get comfortable
Mhm.
with the medication that they're actually taking. So I do
Mhm.
think that people experience more side effects and issues, and they're not asking their doctors, and the doctors aren't that much concerned because you're not bringing up the concern. The
Right.
doctors are only going to be concerned if you're
If
concerned.
you're concerned. I want to segue into I want to talk a little bit about the judgment part. What are, as women, we are facing already daily judgment in our career, where we're at in life, our status, our demographic background, and now we're facing judgment with weight loss. I'm just going to give a little bit about my personal journey with the weight loss. I said, my doctor said, initially he said, I want you to sit down, I want you to talk to me, I want to help you with your weight loss. I'm going to be honest. Initially, I thought the medication was, for diabetics, one. Number two, I thought that, in my head, I thought, oh, I can just take an appetite suppressant, like you said. I can just, practice more better eating habits, which I wasn't doing because the numbers were climbing in all areas, in my health chart and also in my weight. I'm 53 years old now, and so I've experienced having a knee replacement and arthritis in the other knee. And when he said that to me, it sounded so sincere. He said, I want to start you off with just, some the pill form and then move into semi-glutide. And that was based off of insurance purposes. But when I started taking the medication, instantly I had energy. Like I came home, I started walking in March. It was 2 years now. I started walking in March. and I started losing the weight fast. And I was just more happy with myself internally. It did something to me internally. It did something to me to have that level of energy and not feel like, okay, I have to go home, I have to take a nap before I do anything else. And so I believe that medication helped me out with that. It helped me again with my health chart. When I say health chart, everyone, I'm talking about, your numbers when you do your blood work. And so I was pre diabetic, cholesterol levels up, blood pressure was up. In 6 months, everything went down. I had the knee problem. So the 40 pounds that I took off so far has helped tremendously. My doctor said one quote to me, and he said to me, he said, "You lost 40 pounds, right?" I said, "Yes." He said, "How many pounds of potatoes do you buy at the grocery store?" I said, I buy 2 or 3. He said, "But they have 5-pound bags." I said, "Yes." He said, "Put 8 of them on your back and walk around the grocery store." And I was like, why would I put 8 pounds, 8 bags of potatoes on my back, 5-pound bag?
That's
That's
what you
40
was
pounds.
carrying.
He said, exactly, that's what you was carrying. And I was like, wow. Like, I couldn't believe it because I've carried 2 pounder bags around the grocery store, and it's heavy.
Hmm.
So he was like, you was carrying that on your knees. And no wonder you were suffering every day. So ladies, I encourage you, if you're experiencing judgment out there, listen, do you. Do what works for you. Okay. So, Brandy, when did you first start hearing about GLP-1 meds, and what was your initial reaction?
So I'm a type 1 diabetic,
Mm-hmm.
and
Mm-hmm.
so insulin dependent. I take fast acting insulin and a
Mm-hmm.
nighttime, long term, overnight insulin.
Mm-hmm.
But because obviously with age, you just naturally gain weight. Things don't sit how they used to when you were 25. So I had
Right.
gained weight just being on diabetes. And I tell everybody, when you first find out you're diabetic, it's almost like going through the stages of when someone dies. You go through like grief, denial, and all the things, and you start thinking about
Mm.
all the things you can't eat, and then you start consuming them all. So in my diabetic depression, as I like to call it, I gained about almost 100 good pounds. At my biggest weight, at my highest weight, I was about 300 pounds.
Mm-hmm.
Um, and I got down naturally to about 200, and then I teetered between 250 for
Mm-hmm.
a while. So my doctor, because I was a diabetic, was said, "Hey, um, let's try Ozempic. A, because you're a diabetic and this could help, and B, it can also help with the weight loss. And also with insulin, there's also the insulin also slows down naturally your gastric emptying.
Right.
So you naturally can gain weight because you're on insulin as well,
Mm-hmm.
because your metabolism and everything else slows down because you're taking a form of insulin that's not naturally produced in the body.
Mm-hmm.
So that also contributed to my weight gain.
Oh.
So we sat down and talked about it, and I had to go through. They don't generally approve GLP-1s for type 1 diabetics, so I had to go
Mm-hmm.
through all of the prior authorizations and talking back and forth with the
Right.
insurance companies just to get approved. But I ultimately I got approved for Victoza
Mm-hmm.
when it first came out, which I think
Mm-hmm.
then when it turned into Ozempic. So I was taking Victoza for my diabetes, and that's how I first got introduced to GLP-1s. And again, because it was Victoza and it was for diabetes, I didn't even know at that time that it was going to do all these things for weight loss. But because she was very knowledgeable as a doctor, she was like, they're going to release it as a GLP-1. It's been
Yes.
helping a lot. There's been a lot of studies because this was like way before. it came out on the market as just a GLP-1 for weight loss. And she was
Mm-hmm.
like, but most of the patients have lost weight. And she was like, a lot of her patients that were diabetics, because she was my endocrinologist, were losing weight when they got on the Victoza at that time. So that's how I got introduced to it. And of course, because I'm a scientist, I obviously did my own
Mm-hmm.
research and all the things. And I was like, okay, I'll try it. But in taking it, I also took less of my insulin and less of my nighttime insulin,
Right.
which is my long term insulin. I still stayed at the same
Okay.
insulin dosage for my meals, my short acting insulin with my meals. But because we knew that, gastric emptying is lowered and things like that, she was like, she wanted to wean me off of my nighttime insulin. So currently, I don't take my nighttime insulin unless I absolutely need it because I went, to eat all the things at like a fancy
Mm-hmm.
restaurant or a party or something.
Mm-hmm.
And I know that I might need to keep my levels in check overnight because I had the wine and all the things. But for the most part, I just take my fast acting insulin with my meals and I take my GLP-1 once a week now because I did get approved to get switched over I currently take Manjaro.
Excellent,
So,
excellent. Now, can you talk a little bit about, because here's another misconception, diabetes type 1 and diabetes type 2. What's the
okay.
difference?
So type 1 diabetes means it can mean one or two things. Either you don't produce any insulin, so it's
Mm-hmm.
a genetic defect, and you're born with it.
Mm-hmm.
So your pancreas just isn't producing any insulin. You don't have any islet cells and things of that nature to
Mm-hmm.
uh, convert the glucose and get rid of some of the glucose that's in your blood sugar. So and then there is now they're finding out there are other forms of type 1 diabetes where
Okay.
you so on your you have a C peptide level.
Mm-hmm.
And with in people with type 1 diabetes, their C peptide level is not existent at all because they have no ability to produce insulin. But then with people who they're terming it like type 1.5, so
Mm-hmm.
you have a C peptide level, but it's really, really low. Um, I don't know exactly what the no, I'm sure I can look at one of my charts and find out what the range is, but I know if you're below like 2, you can be considered a type 1.5 diabetic.
Mm-hmm.
And
Mm-hmm.
they're diagnosing these individuals later in life. So myself, I'm type 1.5. So
Interesting.
I produce insulin, but not enough, but not to the point where it was type 2 diabetes. My C peptide levels were low, so they have to do a different like testing panel and things like that. So my C peptide level was below the normal range, but I still produce enough
Mm-hmm.
so I'm getting a reading on my for a C peptide, but not enough to say she doesn't have diabetes. So I
Right.
got diagnosed with diabetes when I was 30.
Okay.
So on a personal level, I ended up getting an infection in my left breast and I did not know why. And when I went into the
Mm-hmm.
doctor to find out what was going on, because I thought I had breast
Mm-hmm.
cancer,
Mm-hmm.
they found out it was an infection and for some odd reason, she's like, well, let me test your glucose. And my glucose came
Interesting.
back at like 800 and something. And I had been in and out of the hospital for a series of months with this like same infection. And my glucose came back like 800. And she was like, I
Mm.
don't even know how you're walking around right now. And she was like,
Exactly.
she's like, you're diabetic. And I was like,
Right.
wait, what? And so then I started doing all the things that they would give you for a type 2 diabetic, but nothing was working. And so then I went and
Right.
sat
Excellent.
down with an endocrinologist, and that's how I found out that I was type 1.5 and all the things and
Mm-hmm.
got put on insulin and things like that. But with type 2 diabetes, your body still produces insulin. Now, the amount of weight that you have gained based on your type 2 diabetes can diminish. the amount of
Mm-hmm.
insulin you produce, because again, your body's like, you're not using this energy, so why do we need to get rid of it? So it's not, the insulin isn't functioning correctly, or
Mm-hmm.
it's been producing so much insulin because you have such a high carb ratio that now it's just malfunctioning, because it's like, well, we don't know what to do with all of this insulin we're producing for all of these carbs that you just continue to eat. And so we have all this insulin and glucose
Right.
in your body, and we don't know, we're just malfunctioning on a cellular level. So
Right.
that's the difference. So with type 1 diabetes, you produce no insulin. With type 1.5, you produce insulin, but your C peptide levels are really, really low. So the amount of insulin that you are producing is so low that it's not functioning properly. And with type 2
Mm-hmm.
diabetes, you still produce insulin. It's just not being produced at a functioning level to either keep your glucose in check, in the range that it's supposed to be in.
Right. And just some clinical numbers for the audience out there. So you mentioned about how your blood sugar was basically 800. So a little background. So normal fasting blood sugar is usually between 70 and 99. Then after eating, it can go up to generally 140, but then after 2 hours, it begins to drop to normal. For pre-diabetic range, it's between 100 and 125 fasting, and diabetics, it's 126 or higher, and that's fasting. Of course, more tests are done after that. So when you actually went into the hospital for your infection, you were at 800, right? Which
Yes, yes,
sometimes actually put people in what they call a diabetic coma, and
yes.
or ketoacidosis, which means their kidneys start to fail, their organs start to fail basically on them. But then also you could have went into a diabetic coma. I'm glad that you actually, went to the doctor, you went to the hospital, and even though you was going for months, you were an advocate for your health. I think as women, it's important that you be an advocate for your health. I work in a clinic, and I had a patient tell me, he said, I've been having the same symptoms for 6 months. I've been going to the doctor about it. And I said, well, go to another doctor.
Mm-hmm,
Go to a
mm-hmm.
doctor until you feel as though you're getting a remedy or getting the answers that you deserve. You deserve the answers. And he was an older gentleman. And I just felt like, don't just allow a doctor to, brush aside your illness and just tell you, okay, you can just do this, but it's something that you're going to live with. I always say seek a second opinion, okay? So how have you seen the impact of GLP-1 medications personally and professionally?
And we were talking before we actually started about the stigmatism that is put
Mhm.
on women who take
Mhm.
GLP-1s. Like I said, there are some personal trainers out there who actually won't train, uh, give you any physical fitness tips because you do take a GLP-1, which for me, we all know that, like I said before, as you age, your metabolism slows down. Things don't operate the same way they did when you were 15, when you were 25, even when you
Right.
were 35. So I can run a mile and in 20 minutes. When I was younger, I can run a mile in 4 minutes because I ran track. I did all the things. So there's
Mhm.
obviously something different. That time has decreased since I've been actively working out and doing all the things to just get my own health back in check and things like that.
Mhm.
But so I think with that some people need the extra help, and I think it's
Right.
it's not, it's just like the trend of when fen was on the market, and we know that was
Mhm.
actively
Yep.
killing individuals. One of my nurses, when I was
Yep.
to my pediatrician, actually died from taking fen. But there was that whole
I've
thing.
heard a lot about that. Yeah.
And I
Yeah.
think I think GLP-1s was a safer, scientifically. than having to take something that
Mm-hmm.
has all of these extra components, caffeine components that cause you to be jittery and things like that. Even with the natural
Mm-hmm.
energy burst that you had, I think that was a natural energy burst. And I think some of it is even psychological that you automatically say, I'm on this GLP-1, I'm on this weight loss journey. So your body kind of adjusts
Yeah.
psychologically to the fact
Yeah.
that you're doing better, you want to do better. I don't
Mm.
think the energy burst came from taking the GLP
Mm-hmm.
1. I think
Mm-hmm.
you had made up in your mind that, hey, I want to make a change. And in
Mm-hmm.
doing that, I'm taking this GLP-1, but I want to make a change for my own life. And so that I can be able to walk and move my own knees. And I think with that came your own natural energy burst. So I think that taking a GLP-1 has a lot of stigmatisms, but I
Mm-hmm.
also think that some people need the extra help. Just
Yes.
like if your doctor hadn't have sat down and had this serious conversation, like, hey, you might not be able to move around in a couple more years because you've had this
Mm-hmm.
knee replacement, you're carrying this extra 40 pounds
Mm-hmm.
with you, and I don't even know how you're still standing today. And
Right.
you had, and he said, hey, I can help you. I can give you this to say, hey, we're gonna, so I can walk around, so I can be there for my kids and my husband and all
Mm.
the things,
Yes.
which is the main goal. You want to live. So I think
Yes.
there's nothing wrong with having that extra push in the
Mm-hmm.
beginning, but it's a
Mm-hmm.
matter of having the conversations in between from when I
Mm-hmm.
start and when I finish that matter. And I feel like a lot of women aren't having those conversations, which leads
Mm-hmm.
to the stigmatisms that are being put on people who take GLP-1s. And I also think that if a trainer says no, they won't train you, find one that will train you because there's someone
Right.
out there that has um, taken all the courses and specialized in helping
Mm-hmm.
women to lose weight while they're on GLP-1s, lose healthy
Yes.
weight, as well as even wean yourself off of them. Ask those questions. Because, like I said, you
Mm-hmm.
don't have to take it for the rest of your life. It's not even recommended. Again,
Right.
none of these studies have been proven in humans. It's only showed up in mice that cancer and the kidney failures and all those things. And
Mm-hmm.
because it is an understudied area, and with science,
Mm-hmm.
there's always questions and continuing to run tests, but ask the questions, be the person who steps out of the box and says, hey, after I've lost my 50 pounds or
Right.
45
Right.
pounds or whatever, how can I maintain my weight? And again, if you're doing all the things, eating healthy and things like
Mm-hmm.
that, you can maintain your weight without taking the GLP-1, but everyone needs a start. And I
Right.
think with every weight loss journey that you're on, it has to start out with some form of motivation to do something. And
Mm-hmm.
because GLP-1s do work, that's already a natural motivator. If
Mm-hmm.
your goal is to lose 2 pounds and you get on your GLP-1 and you lose 3 pounds in that week, that
Mm-hmm.
probably was the hardest 3 pounds to lose when you weren't on the
Right. Right.
GLP-1. That is a victory in my
Right.
my opinion. And again,
Yes.
I didn't even start taking GLP-1s for weight loss. I
Weight
started
loss.
taking them for my diabetes,
Mm-hmm.
but it added to the weight loss component. And just like you,
Right.
I was like, hey, I want to lose these, 100 pounds. So let me work out, let me eat right. So I
Mm-hmm.
think there's a mind shift component that comes with it as well. And in shifting the mindset, you automatically shift how you're going to feel and think, even if you weren't taking the GLP-1.
Mm-hmm. Mm-hmm.
So, and
And
that's a
definitely
lifestyle
when
change.
yes, when you spoke about the mental part of it, and I agree with you because when I started taking the medication, it was in the winter time, and I had this burst of energy, and I was like, "Let me put on my coat, scarf, and hat." Never did anything like that before, but I was so motivated. The conversation that I had with him, which was just honest feedback, and me really taking an inward look at myself, where I was, and the struggle that I had been through and really just listening to people who are close to me their heart in the matter, right? Because you have
Hmm.
people around you that love you, that tell you, like, hey, and then working in the medical field, you can see, you can be like, okay, I already know that X plus X is going to, what this
Hmm.
is going to end up doing, and so I need to do something more. So there is that mental component of it. I do believe that if you said lifestyle change, and yes, I'm not always perfect. Sometimes I do have my cookies, my candy, my wine that I enjoy, but it's not in the consumption is not as much as it used to be. And those are decisions that I weigh because that is not suppressing my appetite. But I just sit there and I'd be like, Drain, should you have these berries or should you have this Snickers bar? Right? Have the berries. So sometimes it's a matter of just like making good choices, as you said, like making lifestyle changes. Um, so in this conversation, of course, we talked a lot about how it's basically designed for people who are diabetics, but then also now this trend with weight loss. But I believe that this whole conversation is necessary because it's more than about weight, right? It's more than
Hmm.
about weight loss. In your perspective, what do you feel like this conversation about GLP-1 meds, how do you feel like basically, do you feel like this is more than about weight?
I definitely feel like it's more than about
Mhm.
weight. I
Mhm.
think, especially with the tech age and
Mhm.
so many people on TikTok and Instagram and YouTube, that is a lot of people's form of making money. And, 20 years ago, you wouldn't have had to be on a camera to do everything. You wouldn't have even had to do a podcast. We'd just be on a radio station. Nobody would see me. They wouldn't see
Right,
you.
right, right.
We
You're
just be
right. You're
listening,
right.
or it would be a television interview. But I think with the exposure, the weight loss lifestyle component has become so important. So now every every way to make money, especially to make money really quickly, is through some type of social media outlet,
Mhm.
which means I have to
Mhm.
show my face. I have to show,
Mhm.
there are some people that do it that don't show their face at all. But a lot of it, you see people's face, you see how they're living, you see what they eat, how they cook, all the things.
Mhm.
So I think the weight loss component became important in this tech age, but
Mhm.
I also think the promotion of self care, mental health has
Mm.
also grown with this shift in technology. So I think it's twofold. Yes, we want to lose weight to be healthy, but now we're talking about mental health, mental clarity,
Mm.
self
Yes.
self care, and I think
Yes.
the two go hand in hand: self care and my weight loss journey.
That's
So
an
and
interesting point that you brought up self care in relation to that and the weight loss journey because, sometimes we think about self care and we think about a massage, a facial, getting our nails done, but then also, the whole entire body, the spirit, the mind, and the body, focusing on that and making sure that those areas are healthy too, are self care, and sometimes we need help in that area because then we're not
mhm.
totally balanced, right? So, what role do you feel like a caregiver, which is a provider, and social media needs to play as far as like their push and with GLP-1 meds?
Well, I think the providers should definitely give more information behind
Mm-hmm.
side effects, and misconceptions that come with
Mhm.
it,
Mhm.
as far as the weight loss component is
Mhm.
concerned.
Mhm.
I think that's the missing piece. I know a lot of people are, oh, I just want to take Ozempic, but they're not asking any questions, or I'm taking the
Mhm.
GLP-1 pill forms,
Mhm.
but they're not asking any questions. And
Mhm.
it's great that I'm in the field that I'm in, but I'm always like, hey, go talk to your doctor, because I don't take that particular GLP-1 and I have no
Right. Right.
experience with it. So I can't answer all the questions. I can just give you some of the scientific knowledge that's general to all of them, but ask the questions. So I think that's where the providers need to give more insight into the GLP-1s that they're prescribing. What's the
Mhm.
difference between them, how they work, what's their mechanism of action on the body, what type of side effects are you going to experience, as well as dispel some of the myths. Like I said, a lot of the cancer, renal failure, things like that, aren't actually studies that have been performed in humans. A lot of them have only been found in mice.
Right.
Mice bodies don't operate the same, so we could very well, as humans, never experience any of those things. But if it is a concern, talk to your provider about it, mention it, bring it up, find out what type of screenings you should be doing to ensure that you're not going into renal failure or
Mhm.
developing any type of tumors that are out of the ordinary. I mean, you should get those tests anyways, but I know some people, I think anytime you take any type of medication that has any type of side effect, you should be more on top of your physical awareness than anything. If they're prescribing
Right.
you insulin, if they're prescribing you uh, a blood pressure medication, make sure that you're
Mhm.
getting your 6 month, 3 month wellness checks to ensure that this medication is working the way it's supposed to be, and you're
Mhm.
not experiencing any side effects that are unheard of. Um, Whatever that
That's
looks like for
interesting.
the medication that you're taking. I think that's important. I make sure, even just taking insulin, I've always found, even if I gotta search the net, if I gotta look
Mhm.
at their degrees and
Mhm.
all the things, I make sure I find me an endocrinologist where all that I know that they're about their patients. I make sure that my doctor is number one advocating for my wellness. If I get a doctor that
Right.
just don't ask me enough questions, I
Right.
will switch providers, because I
Right.
need you to care about me. I need to be
Exactly.
important. I don't just
Exactly.
need to be a number on a chart. I need to be important. You need to care about my well-being. And I've been very successful in doing that. But I don't think, as women, we spend a lot of time questioning our providers um, about our health care.
Mhm.
We lose babies and all the things much more than other races as Black women. And I think we need to spend more time questioning our providers and asking the right questions for the betterment of ourselves. So I think that that's an important component. The social media part, um, there's always, as of right now, there's a new social media outlet that comes out every few months or
Every
changes its name.
5 seconds.
And then now you add in chat and artificial intelligence.
Right.
So
Right.
it's just going to keep growing. And so the self wellness awareness piece has to be
Mhm.
important, because there's always going to be this competitive outlet of media, what you look like,
Mhm.
what you how you should look. That's, I mean, we thought it was bad with
Mhm.
just commercials and cable 20, 30 years ago,
Right.
but now it's everywhere. I mean, I can make the posters and change my body, my face, the way I smile, put a cup in my left hand with artificial intelligence. So it's
Yes.
that piece is always that piece is just going to continue to grow, I think. So I think it's important
Mm.
that people um do the things to feel good about themselves, but not to the extreme.
Mm-hmm.
So I think that is where your conversations with your provider become important, and conversations
Yes.
with counselors or whatever self wellness, self care that you involve yourself in becomes important, because we can't let
Mm-hmm.
society dictate how we should look all the time. Granted, everyone should care about their health, but everyone wasn't
Right.
designed to be a size 2 as well. So there's also that part of it. You know, if you're taking GLP-1s because you want to be a 00, and you don't
Mm-hmm.
have the, the body type to be a 00, now that's unhealthy. But if you're taking
Right.
GLP-1s because you want to be more healthy and are doing things to consciously have a healthier lifestyle, then I think that's important. So your mental wellness plays a very big role in taking any type of weight loss medication or even
Mm-hmm.
having weight loss surgery. But I also think it also is important to have these discussions with your provider and whoever you have looking after your mental health. Um,
Yes, yes. And you talked about, of course, mental health again and how the importance of that. And of course, we know that in a lot of women, we just feel like therapy, we don't need that. We can just handle it on our own. And I just want to express to people that therapy is a part of wellness, it's a part of overall just taking care of yourself. You have to know, recently I took a mini course on burnout, and I had to understand triggers, understand what to do in those moments, and understand balance, like how to end work, right? Not taking phone calls after hours and things like that, and understanding that that is a mental part, because what told you or who told you you had to be superwoman, right? So all of that, and then of course tie that into weight loss again. You talk about women who are on this weight loss component and they're saying like, I want to be a size 5. Who told you you need to be a size 5, right? I
mhm,
think hand
mhm,
in hand, your doctor, you work with your doctor, and your doctor will tell you, okay, you're at an ideal weight, you're at a great weight, you have good muscle mass, your your my chart is good right now where you're at. Because I spoke to my provider and he said, he has women sometimes they can go to the extreme where they start to see themselves huge even at a smaller size.
mhm.
And so they're at a size 8, but they still see themselves mentally at 16. And he said that that's the mental part of it, where all of that has to be reshaped, not just physically, but mentally too. Okay. So, Brandy, as we wrap things up with this conversation, I'm enjoying this conversation about just GLP-1 meds and understanding that it's more than just weight. What would you like to leave the women? Some takeaways from this conversation.
Oh, well, like I said, number one, it's important to research the medication that you're on.
Mm-hmm.
Not even just for GLP-1s. That's any medication that you're on. If
Mm-hmm.
you're taking
Mm-hmm.
calcium channel blockers, ACE inhibitors for blood pressure, or any of those
Right.
things, do the research. I mean, because there are a lot of medications that are not popular for the African American or Black population, and people will put you on them not knowing the side effects. My aunt actually died of kidney failure because she was taking a ACE inhibitor that caused her to have kidney failure, and she passed away in 2022 at the age of 49. So know the medications that you're taking, not just surrounded around GLP-1s, but talk to your providers, do your own personal deep dive and research into the
Mm-hmm.
side effects and the things for those medications. That is important for any medication that you take. And again, the mental wellness piece. Um, Take care of your mental health. I know we live in an age where it is more popular now than anything to look beautiful and feel beautiful and all the things. But in looking beautiful and feeling beautiful, don't go to the extremes where it becomes unhealthy. Again, therapy isn't just for crazy people, as a lot of my friends. I gotta go see a shrink. I'm
Right,
like,
right,
no.
right, right.
You can go to therapy for anything. Just to have someone to talk to, because sometimes an outlet that doesn't know
Mm,
anything about you personally is the best
right.
outlet, because they're not judging you with predetermined eyes. And sometimes you just need to have that conversation with someone who knows nothing else about you. And you never know. It could be the best thing or the worst thing that you ever did, but there's always a revelation piece but behind it.
Mm,
So take care of yourselves mentally, physically, emotionally, and all the things. And I think that if you are doing any type of weight loss thing, be it weight loss surgery, GLP-1s, or anything, be conscious
mm,
of side effects, and be conscious of why you're doing it, so
right.
that you, like you said, I have friends who still look in the mirror and they see the 300-pound person, so they
Mm,
have ended up bulimics and all the things. So
mm-hmm.
just know your why, and make sure that your why isn't surrounded around social standards, but it's for your own health, for your own change, like you said, for your own mental clarity. So that's important.
Excellent, excellent. Ladies out there, I want you to understand that Ageless Ambition is created for a safe space, for an informed space, for a place where we have real conversations that are reflective of the things that women are going through in their everyday life. And I hope this conversation blessed you. Brandy, I thank you so much for your time, for your expertise, for just sharing your vulnerable moments related to your weight loss and your diabetes, and just educating us. You really just shed some light on some things, some misunderstandings that I had, and making sure that we understand that we have to take care of our mental health, including our overall health. Like, it's a combination, and it is self care. Brandy, I thank you so much for joining me on tonight. Ladies, I'll see you next time. Ageless Ambition, next discussion. Thank you.